Hi, everyone. I decided to do my project on juvenile rheumatoid arthritis, JRA. The reason that I chose this is because I'm actually someone that has JRA. I contracted JRA when I was 6 years old. And as I go through this, I can kind of give you some insight onto the things that I came through or went through because I pretty much had a textbook case. So, what is JRA? JRA is an autoimmune disease, so it is not the same as the arthritis that an elderly person would get. Uh, there are unknown factors. There's no magic combination of genes or uh, some sort of magic way to compute to see if someone's going to get it. It's a very mysterious disease. No one really knows how it happens. They just know that the immune system goes crazy and starts attacking itself. They do believe that there may be environmental factors that lead to it. For instance, right around the time that I woke up with JRA, my elbow was the size of a softball. I couldn't move it. It was swollen. It was enlarged. My uncle had broken his ankle and had a staph infection called osteomyelitis. They believe that him carrying it and me living in close proximity with him and being so young and having an impressionable immune system, as they would say, they think that that sort of made my immune system go crazy. So there are factors where kids can come in contact with certain diseases or issues, and then it'll cause their immune system to not know how to fight it or not be strong enough or mature enough to fight it, and their immune system just goes haywire. We do know that females are most likely to be the ones that get JRA. Out of 10 children, they say at least 6 of them will be female if they all have JRA. So it's pretty prevalent in women. It shows up as early as 6 weeks old. So if you can imagine a small baby not being able to move their joints and having these issues, it happens. It's not genetic. Both of my children are tested every year for it, and neither of them have the RF factor in their blood. It is not the same as the arthritis you'd find in an elderly person. It's important to remember that. Theirs is sort of a degeneration of the joint that happens through old age and time. It is not because their immune system is fighting itself. How does JRA affect the body? Well, like I said before, the immune system starts attacking joints. Something happens and it believes that the joints are foreign issues. They think they're foreign entities. It will happen mostly in hinge joints. So any of your joints that you can bend, like your elbow, your knees, your ankles, your toes, anywhere where there's space between joints that you can move. What happens is the body's actually going to destroy the natural fluid that protects the joint. We all have it. It's called synovial fluid. And people with JRA, the disease actually goes in and destroys that synovial fluid, and it's replaced by a nasty inflammation that actually causes pain, swelling, inflammation, and joint erosion. JRA is not fatal. You're not just going to die because you have JRA. However, it can lead to some serious issues because of all that swelling and inflammation in the body. It can travel. It doesn't have to just stay in a joint. So a lot of times what happens is the immune system will then start attacking other large organs like the heart or the lung and the eyes, and it will cause inflammation there and cause heart attacks or the lungs to fill up with fluid, which those things can lead to death. So JRA itself may not be the killer, but the rheumatoidism in the body can lead to other major issues. There are 2 types of JRA. It's important to note you will not know what type you have until a year after you're initially diagnosed. They need a year for the disease to present itself so that they know how it's going to affect the body. One of the most common forms is oligoarticular JRA. That's a mouthful, but it affects 4 or fewer joints within the first year. Again, it is the most common form of JRA. It often affects the knees, the hips, the elbows, the fingers, the toes, and the eyes. Many children will outgrow the disease if they have oligoarticular JRA. Again, mysterious disease. They don't know what causes a child to just outgrow something that afflicts them so horribly as a child, but they do. They think it may have something to do with puberty, but they're not sure. Polyarticular JRA, which is the form that I have, it will affect 5 or more joints in the first year. It's known as the copycat JRA. So basically what that means is it started in my right elbow. Within 6 weeks, it was in my left. Then it moved to my left wrist, shortly after it moved to my right wrist. So it sort of copies itself as it moves throughout the body. So if it goes to your right knee, your left knee, and so on and so forth. Polyarticular JRA is aggressive. It's very, very aggressive. It'll cause erosion of the joint. It's often the contributing factor to fevers, rashes, whole body weakness, rheumatoid nodules that are found under the skin. I've had all of these at one point in my life, but more so when I was younger. It's also polyarticular JRA is responsible for little limb syndrome. What happens is, say a child has severe JRA in their pinky finger. What will happen is it'll stunt growth. So the pinky will remain the size of the child at 5 years old, and the rest of the fingers will grow out around it. This happens to kids with legs and arms as well. So you can imagine the issues that arise when your leg is the size that it was when it was 5 years old and the other one grows to adult length. Treatments, most common is NSAIDs, non-steroidal anti-inflammatory drugs. A lot of doctors want to go right to steroids because they're great for reducing swelling and pain. The problem with it is your body creates a tolerance to it, so then they have to keep increasing the dose, which then leads to weight gain. It's really hard to wean off. Once you're on 6 or 7 pills, you can't just say, okay, I'm better, I'm going to stop taking them. You have to go from 7 to 6 to 5 to 4 in 2-week increments. So it takes a really long time just to stop them. The other issue is because they're all juveniles, a lot of times the great medications that help stop joint erosion, pain, and damage to the joint, they're only FDA approved for adults. So when you see things like Enbrel, methotrexate, commercials for things like that, they're only approved for adults. So when you have a child who needs these medications, they have a hard time getting approval because they're children. That's gotten a lot better as years have gone on, but insurance company will make you go the route of you'll start out with pills. If the pills don't work, then they'll move on to subcutaneous under the skin injections. So Enbrel's one of those, methotrexate's one of those. They usually take them once a week or every other day. I'm at the point where I'm at infusions. They actually make infusions where I go once a year, and you sit there and you're good for the year. PT and OT are often coupled with these forms of treatment because once JRA is in a joint, it sort of locks the joint, and the only way to make it unlock is by reducing the swelling and hoping that it didn't cause enough damage to sort of lock the joint in place. If that happens, surgery is the only option. That has happened to me quite a few times. I'm at my 12th surgery now. Prognosis, 60% of children with oligoarticular JRA outgrow the disease by the time they reach 25. They'll experience no symptoms again in their life. Again, it's mysterious. They don't know why. Another interesting fact about it is for women, pregnancy often sends them into remission. I have experienced no flare-ups since I've been pregnant 4 years ago, so it sort of rings true. The sad thing is for children with polyarticular, only 25% of them will go into a permanent remission versus the 60% with oligoarticular. Difficulties with JRA, it's invisible. You can't see it, so people don't believe it. They think it's an old person's disease, that, they kind of write it off, just take an Advil, it's arthritis. It's something that you only get if you're old. People don't believe it's a disability. When you think back to when I talked to you about little limb syndrome, these kids are actually dealing with serious disabilities and serious issues. And people just look at it as just arthritis, something that everyone's going to get. So what it looks like. Sorry, this is gross, but I feel like you have to see it to sort of believe it. This is a foot surgery that I had last December. My foot wasn't feeling well, and I couldn't really understand what was going on with it, why it was sore. So I just decided to go to the doctor, and he said, listen, your synovial fluid's gone, your foot tried to fuse itself, and it was unsuccessful, and we have to go in there immediately or your foot will literally fall apart. So, it was a serious transformation. Here is the inside of my foot. I have about 12 screws and 3 plates. As you can see, this is common practice for kids with JRA. This is a talonavicular arthrodesis where they fuse. The arthrodesis is a fancy word for fusion. They often try and fuse the joints because if they pull all your joints together, no inflammation can get in them. The problem with that is it often leads to loss of mobility and such. So my foot actually feels great. I haven't lost much mobility at all. However, it's just not so cute inside anymore. But point is it worked. but it's something that you live with lifelong. Another thing that you can look for is if you look over here at a normal hand, you see the nice gaps of synovial fluid between all the fingers. And then you see this rheumatoid hand over here. And this is where it sort of eats away at the joints. And you see how the fingers sort of fall over to the side. This is my hand. Mine is, again, textbook RA, where, my fingers are falling over here to the side. When I just lay it flat, they just fall because the disease has sort of obstructed the bone and the tendon. And this is sort of what the disease does. It goes after those little inlets that you have in between all the spaces in your joints, and it sort of eats away at it and causes damage and pain. So that's pretty much all I have for you. I hope that this helps you get a better understanding of what this is, what causes it, which no one really knows. But that if you ever encounter a child with this disease, you sort of understand what they're going through and can hopefully help them through it, and know that what they're going through is very much internal, and it's a very lonely process to go through, especially when no one really understands what it is. All right, thank you.